just want to take a second to thank Ashley Hillman from Safe Communities. Ashley's a terrific resource here in the Madison area about falls, but I'll let her tell you more about Safe Communities in general. Ashley, please go ahead and take over.
All right. Well, thank you all so much for the invitation to talk about falls today. And as Mike said, my name's Ashley Hillman. I'm the Falls Prevention Program Manager at Safe Communities. If you're not familiar with Safe Communities, it's a nonprofit on the east side of Madison. It's a nonprofit injury prevention coalition organization. So what that means is we look at the top causes of injury death in a certain area. So for our area, it's Dane County. And then we build coalitions around those top causes of death to try to change those numbers. So in Dane County, that would be suicide, traffic safety, drug poisoning, and falls among older adults. So there's a lot of work going on outside of falls at our organization. And if you're interested in any of that, just let me know. My piece specifically is falls, and that's what I will talk about today.
So you have 501c3, Ashley?
Yes.
Okay. True.
Yep. So if you're ready, I'll go ahead and share my screen, Mike.
Yep. Go ahead.
Okay.
And if everyone would mute yourselves. Ashley, do you want to take questions as we go along or at the end of your presentation?
I think as we go along, if someone has a question, just, put it in the chat or just interrupt me because I get so caught up in the presentation, I may not see the chat. Or Mike, maybe you can let me know if someone has a question.
Sure, raise your hand and I'll get you in line so that you can ask Ashley. Okay, go ahead. Please mute yourselves and then chime in whenever you have.
All right, so we're going to talk about falls today, specifically why we should care, and then strategies to prevent one. So just a brief outline. This group probably knows already why we should care about falls, but we'll, unfortunately start with a little doom and gloom, some statistics, both nationally, then at the state level, and then locally. And then we'll kind of segue into some proactive things that you can do to prevent a fall, or you can help loved ones or clients that you're working with prevent a fall. And then I'll kind of just give you an overview of some of the work that's happening in Dane County to promote balance and prevent falls. So here's the start of kind of some doom and gloom. So this is some more recent data, national data. And if you I think Mike will send these slides out afterwards. I won't spend too much time on each, but you can see that the rate of falls is increasing, especially among the 85 plus population. So that's something that we're paying attention to at Safe Communities. How do we target the 85 plus population and be more proactive to reach those individuals before they fall? Every 20 minutes, an older adult dies from a fall in the United States, and many more than that are injured. Just as Jane was sharing with her friend in Chicago, it can happen to anyone. And here's some data. This data is a little outdated, but the premise is kind of the same. Wisconsin is still #1 in the country for fall-related deaths. And I know this is small text, but if you can see the arrow that's in the middle, that's the United States overall. And then you can see Wisconsin is at the very top as having the highest rate of fall-related deaths. And it's actually twice the national average. We experience fall-related deaths at twice the national overall average. A little more doom and gloom. So 1 second, an older adult falls every second of the day. And 1 in 4 older adults report a fall. And this data is a little outdated also, but I think that's about the same now. And that's just what's reported. So we know that falls are occurring at a much higher rate. So if you think 1 in 4 is what's reported, and then that's what's actually occurring is much higher than that. It's quite alarming. And then, oh, Jim, go ahead. I do see your hand.
My husband knows it. He would be able to tell you that. But
I asked, why do you think Wisconsin tops the list? Well, what factors are there here that make us so different from other states?
That is an outstanding question. And if you're okay with it, one that I'm going to try to answer in just a few slides, because that keeps coming up again and again. And we've even had conversations with folks at the CDC, the Centers for Disease Control, about this. So I'll give you some, I guess, or not estimates, but guesses about why that might be in just a little bit.
Yeah, great.
Okay.
Thank you.
And you may notice that on there, it's increased. I mean, since 2006, it's increased substantially. And so, yeah, that's a great question, Jim. Okay, sorry for piping in there.
That's a great question. Yeah. And then the last statistic here is falls are the #1 cause of hip fractures, which is probably not surprising to anyone. So why would she care about falls? It's the leading cause of injury death among older adults in Wisconsin. In 2018, there were over 1,500 fall-related deaths among the 65 plus population in Wisconsin alone. And there were over 43,000 ED visits due to falls among older adults in Wisconsin. Again, this is, we're at state level now in 2021. However, falls are not a normal part of aging, and they can be prevented. And I think this is something that a lot of people are not aware of, that, I've heard a lot of times, well, I'm getting older, so, that might just happen. I might fall. But no, that does not have to be the case. And there are really effective strategies that you can to look at, in your home environment. We're going to talk about some of these things that will help you prevent a fall. So this is getting to Jim's question. So this is a more recent data also, so 2020 from the CDC. This is a map. If you look at the darker colored states, those are states with higher rates of fall deaths. And then the kind of light green, those are states that have lower rates of fall deaths. So you can see Wisconsin is #1. And so the conversations around this have been many. And so I'm going to throw out just some of these thoughts about why Wisconsin is #1. Things that have come up are long winters, but also if you look at some of the other states that have high rates of falls, they're not all in places where winter is awful, 6 months of the year. So that's one thought. Also, vitamin D deficiency. We do have longer winters in Wisconsin, which means less sunlight. And so maybe a vitamin D deficiency could be playing a part in this. The drinking culture in Wisconsin, there have been a couple articles published about this, and locally, I think in the Cap Times. If anyone's interested, I can send that out later. But that just the drinking culture in general. And then one physician told me that, maybe it's because in Wisconsin, everyone is so active, and that a lot of these falls are people who are running, marathons or triathlons, and they're getting injured being just extremely active. Unfortunately, I don't think that's the case. I wish, that was the case, that everyone is just being so active and injuries are just happen to happen. But the one idea that everyone, physicians, the CDC, like everyone keeps going back to, is that in Wisconsin, we are very good at reporting fall-related deaths. So I'll give you an example. So I was talking with a physician who's on our Falls Free Dane Coalition, and she said she had a patient who fell. That patient was admitted to the hospital. That patient then developed some sort of infection. That patient developed pneumonia, and eventually, after a few weeks, that patient did die. Well, the cause of death was reported as being because of a fall and not because of the pneumonia or the infection. So there are some basic standards nationally when deaths are reported, but then states, I think, have some flexibility with the amount of detail they provide. And in Wisconsin, we're very good at, looping back around to that cause of death to the original incident, so the fall. So that's what keeps coming back into the conversation, is that we're very good at reporting fall related deaths.
And what's included? For instance, people ask me when I have like a medical exam or something now, are you afraid of falling or have you fallen? And I crashed my bicycle a year ago and had minor injuries and things. Does that count? Is that a fall or is that something else?
So the definition is when you find yourself unintentionally horizontally. So if you find yourself, I mean, it's a very kind of funky definition, but when you unintentionally find yourself in a horizontal position, that's considered a fall. Yeah. So we're going to drill down a little bit further. So we talked about national, Wisconsin. So in Dane County, and this again is more recent data that we got from our partners of public health. So you can see these are kind of the top causes of injury, death: falls, poisoning, traffic crashes, a lot of the things that Safe Communities builds coalitions around. And you can see that falls are the top cause of injury, death in Dane County. And so I would just invite you to think about this. If Wisconsin is #1 in the country for fall related deaths, and Dane County has a higher rate of injury deaths due to falls, then we have a serious problem. So some of the questions Jim was just referring to, great segue. So this is a falls risk screening that we actually got from the CDC. And some of you, if you do go for your annual visits, you may have some of these questions asked of you, and there's a reason why. So I like to go through these questions because I think a lot of times people don't realize that, yes, they actually could be at risk of falling. But then once you acknowledge that and then identify what those causes could be, then you can actually do something about it and prevent a fall. So we'll go through these questions quickly. And then also, the far right column is great because that explains why this question matters. And if you score, I should say this, if you score 4 or more, you are at risk of falling. These first 2 questions and have a value of 2. So if you answer yes to the first 2 questions, then you are at risk of falling. So if you have fallen in the past year, then you would score 2 there. And the reason this is important is because once someone falls one time, they are more likely to fall again. The second one, I have been advised to use a cane or walker to get around safely. So people who use some sort of assistive device may be more likely to fall. I feel unsteady when I'm walking. So unsteadiness or needing support while walking are signs of poor balance. You can do something about that. I steady myself by holding onto furniture when walking in my home. Again, that's a sign of poor balance. If you're worried about falling, you're more likely to fall. I need to push with my hands to stand up from a chair. So this is a sign of weak leg muscles. So strength, which is also something that you can do something about. I have trouble stepping up onto a curb, also a strength issue. I often have to rush to the toilet. So this increases your risk of falling. We'll talk about that in a little bit as well. I've lost some feeling in my feet. That, obviously if you can't feel your feet, then you're not aware of where your body is in space. And that could lead to a fall. Medications, which we'll talk about in a little bit. So some medications have what's called adverse drug events and could increase dizziness or could make you lightheaded. Those can increase your risk of falling. I take medicine to help me sleep or improve my mood. There are very certain medications that we take that could increase our risk of falling. And same thing with feeling sad or depressed. So symptoms of these feelings can lead to an increased risk of falling. So if you just in your head think of how you answered those questions, and if you scored a 4 or more, then you are at risk of falling. So that's all the doom and gloom, why we should care. And then now we'll move into all of the great work that has really coalesced around this issue so that we can change those numbers. So Safe Community started this coalition many, many years ago. It is called the Falls Free Dane Coalition. This is a volunteer group with representation from our healthcare system, senior centers, home health, physical therapy, the ADR, the Aging and Disability Resource Center, EMS, Public Health, United Way. It's a really great group of dedicated individuals who want to tackle this issue. If you are interested in being on this coalition, email me afterwards, because we always are looking for, new voices, new perspectives at the table to help us tackle this issue. The purpose of the coalition is to look at both the systems and grassroots levels of what's happening in the community, and to then change the rate of falls by working at both of those levels. So an example with the systems level, how are we working with EMS and healthcare to improve referrals into community-based resources? How EMS especially, they're often the first people who are interacting with an individual who has fallen. So how can we take advantage of that opportunity and then plug people into, a community-based program, or to, a referral for a home safety assessment or something like that. But then at the grassroots level, what are we doing to make sure that every older adult in Dane County has access to balance enhancing programs? So, programs that are culturally relevant, programs that are offered at various times of the day. How do we make this possible so that everyone can participate? And then we also have annual falls prevention community-based events that are free. We try to provide lunch at these events to kind of, pull people in, and we rotate locations every year. So in an effort to really try to reach all areas of Dane County. I'll just give you a teaser. This is not set in stone yet, but we are looking at an April, kind of late in April, falls prevention event. These events are really fantastic because we partner with UW-Madison and Madison College. So we have lots of students on site who are walking participants through blood pressure, vision, strength and balance, cognition, home safety, all kinds of screenings, so that when someone leaves the event, they know what the risk of falling might be and what could be contributing to that risk. And then they've got community resources to then, after they leave, hopefully do something about what that risk might be. So the CDC has identified some kind of primary bucket areas of things that you can do to prevent a fall. So the 4 main areas are home safety, medication management, vision, and then balance and strength exercises. And I'll just add, so you see this infographic on the right, speak up. And so that, that may not be a specific, like a tangible strategy, but that is something that is extremely important, that you are your own best healthcare advocate. And if you're worried about falling, if you have had a fall, it is so important to talk to someone about that. Talk to your primary care physician, talk to your family about that. Because it doesn't do any good to just to push it under the rug. And you shouldn't have rugs in your house, by the way. I'm very guilty of this. Speaking of rugs, we'll talk about that in a second. Okay, so just to go into a little more detail about these 4 bucket areas. So home safety. Dane County used to have an amazing program, the Safe at Home program, and they would offer a free home safety assessment to anyone 60 plus in Dane County. That program is no more. However, there is an organization that is trying to revive that program. So I will send out information once that service is available again. I have looked into this, and I've talked with some of our healthcare partners, and I'm fairly certain, check with your Medicare provider, but or your insurance provider, because under Medicare, I think once a year you could get a referral for a home safety assessment. So that would be something to look into, but you would need to talk to your primary care physician about that, because they would have to put a referral in for that. Assisted, yes.
It's Ann Albert. I had an opportunity to join in. And
Yes.
Well, you're on that subject of home safety. I'm hoping I can give an update on that, on Safe at Home. Is that all right?
Yes, I didn't want to
Okay.
say it was you, that we were hoping.
No, that's fine.
Yeah, go ahead. Thanks, Ann.
Yeah, so with respect to home safety, I'm with Age Better, and Age Better is a nonprofit here in Madison, and we founded the SAIL program, Sharing Active Independent Lives. But we are also excited to launch a new initiative and calling it the same, Safe at Home, using that same model. And we are starting with a pilot. So we're offering free home safety and medication safety assessments during the months of March and April as part of our pilot. And we're working in partnership with Madison College, OT, occupational therapy students. So I would say if anyone's listening and interested in signing up for one of those free assessments, to give us a call at 608-230-4445. Excuse me. And we're really excited about hopefully taking this, forward and starting out with this assessment during March and April to get it started. So thank you for that chance to offer that.
And if you could just add that to the chat box so everyone can pick it up.
I sure
your
will.
Contact info. And
Thank
you
you
so much.
You
Appreciate
bet.
it.
Thank you.
Well, that was just perfect, because I have been hoping and just please let this program come back. And I knew that Anne was working on this. I'm so glad you were here today, Anne. Is it okay if we spread the word about that? The March.
Sure.
Okay.
Sure.
That's fantastic. Great.
Thank you.
So assistive devices, it is wonderful to have assistive devices. We need them. I think the important thing here is to just make sure that you're using them correctly. So, speak with your, if you're working with a PT or your primary care physician, just make sure that you're using your assistive device in the way that it should be used. So I mentioned rugs earlier, and I'm guilty of this. We have rugs everywhere. But rugs can be unsafe. If you have a rug, it's really important to make sure that those edges that always want to stick up, that they are taped down. That's very helpful if you don't want to get rid of a rug. And there are, double-sided rug tape. There are things that you can purchase that will help you do that. Clutter is another big thing, making sure that your walk areas are free of clutter, that you have lighting, especially going back to that, if you have to rush to the restroom, especially in the night, making sure that you have a lit pathway to the restroom. Shoes, wearing appropriate footwear. So high heels are probably not the best option. Sorry, everyone. And then I will also add, and I should add this to the presentation, but pets, love them. My little one is on my lap right now, but they can actually be a fall hazard. So making sure you know where your pets are, again, at night too, like making sure that, the pet bed is, out of your walkway, walking your pet on a leash, just being really aware and mindful of, your surroundings and where your body is in those surroundings. Moving over to vision. So it's really important to get your vision checked annually, because our vision changes as we age. So making sure that you have the right, the glasses, or if you need, sunglasses that help with glare. There are lots of resources. We work closely with the Wisconsin Council for the Blind and Visually Impaired, and they are an amazing resource for Dane County. Medication management. So I already spoke briefly about adverse drug events. So it's really important to talk with your pharmacist about all of your medications. And this also includes supplements, vitamins, anything that you might be taking, because some of those could be interacting in a way that makes you feel lightheaded or dizzy. And that's really important to know because adjustments could be made with your medications. And speaking of which, you can have annually a medication review with your pharmacist, so you can sit down with them, bring your medications, and talk with them about what you're taking. So if you have a local pharmacist, just ask them about this, and they'll probably schedule that with you. And it's also important to keep a list of everything that you're taking with you in the unlikely event that something does happen. Then, EMS personnel or someone helping you would know, what is it that you take? And that's important just to have on your body. And then strength and balance. So a lot of those questions in the assessment that we went through kind of speak to decreased balance and decreased strength, especially in certain parts of your body. So to prevent muscle weakness, to improve your mobility and function, there are simple exercises that you can do that target certain parts of your body. So if you find it difficult to get up from a chair or to sit down into a chair, there are certain muscles that you can target to make that not a difficult thing to do. And this will segue into the next discussion. So there are many balance enhancing classes in Dane County. One of which is Stepping On. I happen to coordinate that workshop. Jane could actually speak probably more about it than I can, so I might loop her in just a second. Tai Chi, Ballroom Basics for Balance. MSCR has some really great 50+ classes that do improve your balance. Living Falls Free is through UW Health, and then yoga. So these are all classes that are available in Dane County. And if you go to our website, which I've listed here and can send out afterwards as well, I try to keep the list of classes updated in real time. So if I learn about a new class, then I put it on our website. And on our website, if we have time, I'll actually run through it with you just to show you how to navigate it. But we have classes broken down into risk levels. So if you're at high risk of falling, it's probably best to speak with a physical therapist or to work with a physical therapist for your concerns. But if you're more medium risk, Stepping On might be the most appropriate. If you're lower risk, then one of these dance classes. So it's kind of broken out in that way. And I'll hopefully have a chance to walk you through that. Because I do coordinate Stepping On for Dane County, I wanted to give you just a little more information about that. It's an evidence-based falls prevention program. Nationally, it's been proven to reduce the rate of falls among completers of the program by 30%. A study was done in Wisconsin specifically, and that reduction was 50%. Stepping On is amazing, and I may be a little biased, but it really is an amazing program. It was started in Australia, and then our very own Dr. Jane Mahoney, who is at UW-Madison, she brought the program to the United States, not just Wisconsin, adapted it for the US audience. And then the Wisconsin Institute for Healthy Aging, also in Madison, holds the license for the program. And so we are so fortunate to have this amazing program and resource in our own backyard. It's a 7-week, 2-hour-a-week class, followed by what we call a booster session 3 months after. And we offer this program anywhere we can find 10 people. It's 10 to 15 people. Historically, this has been senior centers, community centers, faith-based organizations, clinics, hospitals. We're very flexible. And the person who's most appropriate for Stepping On is someone who has fallen or has a fear of falling, but who does not rely on an assistive device inside the home. So if you have a cane or walker that you use outside of your home for extra stability, that's fantastic. But if you need that extra support inside your home, then we often say it might be worth talking to your primary care physician about physical therapy. The curriculum is actually based off of what the CDC identifies as effective strategies for preventing a fall. So that strength and balance, home safety, vision, medication management, safe footwear. We have guest experts come and talk about these issues. So it's a really great program. It's not an exercise program, though exercises are a component of the program. It's a lot of great information. And in this year, just this year, the cost is free. There is no cost for individuals who want to take the workshop. We're fortunate to have some additional county funding to provide that. Jane, I didn't know, do you want to say anything additionally about Stepping On? Jane is one of our prized stepping on peer leaders who really make this program successful. Someone who has taken the workshop themselves and then co-facilitates the workshop moving forward.
I guess I would just say that I think it's a really great program. I think the great thing about it is that the people in the class really get engaged and help each other and have good suggestions. So someone will bring up a problem they have, and there'll be answers from the group as to how they could improve whatever they're doing. You know, one suggestion I remember we just had, people were talking about having a flashlight next, carrying a flashlight in the evening or something. And someone said, oh, well, if you have a cell phone, you can use the light on the cell phone. And then people didn't know how to find it. So then they were teaching each other how to find the flashlight on the cell phone. So I think it's a real, I think that's one of the best parts, is the sharing amongst participants.
Great. Thanks, Jane. Yeah, that is very true. That peer-to-peer learning is a huge component of the program. And it's just a really great program. So if you're interested in hosting, if you work with an organization and want to host a workshop, let me know. If you're interested in participating, also let me know. This is also on our website, which I'll show you where to find that in just a second. And this is just some data that for a report I just had to pull. So I thought, oh, I'll just share this with you guys too. So you're the first people to see it. So we get some really great data from Stepping On. We get demographic data, but also data about, you know, knowledge gained and kind of behavior changes. So I just pulled these 2 questions that I can find a way to reduce falls. So you can see, oh, the pre didn't show up. But so pre, that the first session, you know, people is kind of even, like some not sure, kind of sure, yeah, maybe sure. But then by the end of the workshop, we asked these same questions, and almost everybody was either sure or very sure. And this is for all participants last year. And then the other question that I included here is I can find a way to get up if I fall, which is also really important. And you can see, you know, at the beginning, people are somewhat sure. Some people were pretty sure, but then by the end, the majority of people were either sure or very sure that they could find a way to get up if they fell. So I think I'll just do a quick check. Yeah, I think I will have time. So we have a newer website, and I wanted just to take you through that quickly so you know where to look for some of these resources. So now let me see if I can do this. I'm not the most tech savvy, so I'm going to get out of here. So can everybody see the Safe Communities website? Okay, so this is the homepage, but if you go to programs, falls prevention is on the far left. So I'll just click on the first link, is falls prevention in general. And just scroll down briefly. This button here that says start here, falls risk survey, that's the survey that was in the presentation. So you can download that survey, you can print it, send it out to whoever. So that's available for you to use. And then there are some resources here about those kind of 4 bucket areas that you can click to get some local resource information. And then this is kind of cool, because this is everybody currently, individuals and organizations who are on the Falls Free Dane Coalition. And you can actually, they're links. So if you're like, oh, MSCR, I want to know more about that organization, you can click on it and it'll take you to their website. And again, this is an invitation to you all. If you would like to be part of this coalition, we would love to have you. So now we will go to the program. So this is what I was referencing, that I try to keep updated as best as I can. So if we scroll down just a little bit, we have these bucket areas. So high risk. So this would be PT. Medium risk, this is Stepping On. So we'll just click here. We have 5 or 6 workshops already scheduled for this year, and you can find all of that information here, how to sign up, who to call, the cost is here. And we do have virtual workshops as well, so that will be indicated when you go to this page. Because of COVID, we went through a process and we are now able to offer stepping on virtually. So let me go over to this low risk, because these are some of the great community classes that I think a lot of people may not be aware are being offered. So we've got ballroom basics for balance, which is extremely popular right now. We have some virtual classes that are offered. So if you don't want to leave home, especially if, you know, we get a bunch of snow, you can participate virtually. We've got parkour for seniors, which is starting, so if you know parkour, in your head, you probably have this image of these very young, fit 18-year-olds or 20-year-olds jumping off of buildings or jumping from building to building. It's very Spider-Man-ish. But parkour senior is really about how to be in tune with your external environment and use that environment to help improve your mobility. I've heard it's super fun. This is brand new, and this is going to start actually in March. So if you're interested, go to our website. The instructors are fantastic. Lots of Tai Chi, and a lot of these are virtual. So lots of great options. I won't go through all of them, but please refer people to the website, you know, use it yourself. Let me know if you know of a class that that should be added. And then I will show you one last thing. So the keys to better balance. We have an amazing subcommittee of the Falls Free Dane Coalition, and they actually regularly evaluate community classes. And then if these classes meet certain criteria that could be, then they get a designation that's called, quote unquote, balance enhancing. So that it's called the balance stamp of approval. So this group has put together amazing resources. They're all right here. I won't go into it, but there's a video, there are some documents, there are infographics, and they really have pulled together what types of exercise could improve your balance and what should go, you know, within a community class. And we do have some videos here that demonstrate what some of those exercises are. So you can do this in the comfort of your own home as well. So I did want to just to take you through that briefly. If you have questions about our website or want to think something should be added, please let me know. Now I will maybe try to get back to the PowerPoint. Okay. So in conclusion, falls happen often, especially to the older population, especially that 85 plus population, but that doesn't have to be the story. So we can change that story when we acknowledge what the risk might be, and then, you know, figure out what you can do to change that. That doesn't have to be your story, the story of a loved one. And there are certain things, effective strategies that we can do to prevent that from happening in the first place. So I am always available for questions. Email me. Email's the best. Feel free to call me as well. I get questions sometimes just, you know, from a caregiver, you know, saying I'm trying to help my mom navigate this falls prevention space. So can you help me? And I may not always have the answer. I am not a healthcare provider, but I know the most amazing people in this county who are connected and who do know. So I can always, you know, help you find the answer if I don't know it myself. So I'll just open it now, I think, for questions. And then, you know, even after this presentation, if you want to reach out, please feel free to do so.
Fantastic, Ashley. That's really, I had no idea that you had so much activity going on there. It's amazing. Anyway, I'm thinking, you know, people who are interested in other counties, do they have programs like Safe Communities in other counties in Wisconsin?
So oftentimes the Aging and Disability Resource Center in other parts of Wisconsin, they are implementing stepping on, they're implementing Tai Chi. So a lot of times that happens within the aging unit, the Agency on Aging, or the ADRC. We work closely with both of those entities, and actually the chair of our Falls Free Dane Coalition is a supervisor at the ADRC. So these programs are statewide, and if you don't live in Dane County, you can get connected to resources elsewhere. I didn't mention this, but the Wisconsin Institute for Healthy Aging has been really great in bringing together statewide coalition, or they've created a statewide coalition. So they're bringing local coalitions together so that we can learn from one another, and then also have just a more coordinated state effort on preventing falls. So you can feel free to reach out to me. You can also go to the Wisconsin Institute for Healthy Aging website. The WIHA is kind of what we say, the acronym. So WIHA is actually releasing a falls-free Wisconsin center. It's a virtual center that's going to have a ton of data, local data, resources. I think they're even going to have like a virtual home safety evaluation that you can do to help you identify certain risk factors in your home. It's going to be really great. So you can also go to their website to learn more about at the state level what's happening.
By the way, Ashley, could you enter your contact info in the chat box for everyone? Not everyone caught the last slide and copied it down.
I'll also put the WIHA information here too.
So Ashley, I have a question. So do most falls for elderly fall happen in the home, or do they happen when they're out and about?
Most of them happen in the home,
Okay.
in private residence. Yeah.
Because one thing I've noticed is that when I'm visiting other people, I've had a number of falls at other people's houses because they have strange architectural details. Like one of my friends had a sunken laundry room on the first floor, which I stepped into and then forgot it was sunken when I was going to go out. Or at my daughter's house, she's got like recycling like on all right next to the door as you're leaving, and it was just so narrow that I didn't fall, but I tripped up on it. I think those are real risk factors when you're at someone else's house, that they maybe even have things laying around that you can trip over, or grandkids' toys. My grandkids don't seem to understand the idea of leaving a pathway. So anyway, I just thought those are kind of some things that I've noticed, is that it's easy to fall at someone else's house because you're just not used to maybe they have a step up to their kitchen or a step down, or, something that you're not used to in your own home.
That's a really good point, Jane. And that's something that in stepping on, and I think in a lot of these other balance enhancing programs that we talk about, is mindfulness and just slowing down and being aware of your environment, not trying to carry all the grocery bags in at once, up the stairs to the kitchen, just really being aware of your environment and where you are in it. And that can go very far in preventing a fall. Vicki, you have got your hand up.
Yeah, I just wanted to make a comment that I'm fortunately, I had to kind of be in and out because I'm multitasking different departments today. But was there any discussion about Alzheimer's, dementia, and the plaques that build up in the brain? Because with Alzheimer's, dementia also, especially with like early onset, when people maybe haven't even been diagnosed yet, or maybe they're just still in the early stages, but it's hard to always pinpoint when depth perception starts to go away, because I've worked with a lot of clients who can't see, that little tiny place between like their eyes and their nose and right below them. And they can't see, like she was just saying, when there's a slow upgrade or a slow downgrade. So the person I visited recently keeps missing the bottom step. They can navigate steps, no problem going up, but going down is a problem because they can't see down like this. And then another client I worked with, we had to go to the Dane County, oh, where were we? We were just going to court together. But there's this slow upgrade and a big corner you have to turn. And I had to like hold her up the whole way because her depth perception of going up a slope and going around a tight corner completely gone. And then of course, black carpeting, you know, you go into a place, you know, especially at this time of year, everybody has those rubber mats down. And for people with cognitive impairment, they think that's an endless pit that goes nowhere.
That's a very important observation, Vicky. And that's so a lot of our programming and the programming we promote is not geared towards people with Alzheimer's, but you even mentioned, you know, mild cognitive impairment or early stage dementia. And a lot of these balance enhancing programs are appropriate for people who are kind of on the beginning stages. But I think that the annual vision check and then constant communication with a primary care provider might help identify when those changes are occurring and then put some measures in place, you know, or recommendations about home modifications that could be helpful as they're navigating this new terrain. Virginia?
You there, Jenny?
I'm trying to unmute now. That's better. Anyway, I live in an apartment with an elevator and with indoor parking, and I think that really helps me avoid falling. And you talk about toting things up and down stairs and so on. I have a little wagon, as many people here do. So I think looking forward and being honest about how long you should stay in a particular living situation can sometimes help prevent falls.
Completely agree with that. And that, you know, sometimes that's a very difficult conversation to have.
Yeah.
But again, that's the whole, you know, acknowledging what your risk might be, and then knowing that there are things that you can do, measures, you know, that you can put into place. And that's difficult. And I think that's the whole, like, speaking up, talking with your family about concerns that you have, your doctor. So good for you. I mean, that sounds like a great situation. You have indoor parking, you have an elevator. That's the way to do it. That's great. Unlike I was saying, my grandmother she was in her 80s. She lived independently on her own, and she would, you know, very independent woman, you know, grew up, she was a farming family, you know, provided for multiple kids. And she would grab a chair, put it up next to the stove and start climbing up it to reach something in the top cabinet. And I'd say, "Ma'am, let me get it for you." She's like, "I'm fine. Don't you worry about me." I'm like, "Well, I do worry about you." And then, you know, thankfully she didn't fall. But it's situations like that where people think it's not going to happen to me. I'm fine. And it could happen to you. You know, I think just a lot of people are not aware that this issue is such an issue. And then when you look at the data, obviously, you know, it's very obvious that it is an issue. But I think just recognizing that, yes, this could happen to you or your loved one, but also it doesn't have to, because there are things that you can do to prevent that.
When the last stepping on class, we had a 3-month booster, and one of the women didn't want to come because she'd had a fall. And I said, "You really need to come and share your story because other people can learn." So what she had done, she was moving out of an apartment and she wanted to clean the cupboards. And she already had the stuff from the cupboards on the cupboard, so on the counter. So she got a ladder and stood on the counter and was walking along on the counter, cleaning the cupboards and walking over the stove. And you can guess what happened. She ended up falling off, got a big goose egg on her head, ended up in the hospital for 5 days and in rehab for 2 weeks. She is now fine. But I hoped everybody there listened and said, you know, climbing up onto cupboards and is something we shouldn't be doing. Bottom line.
Gosh.
So it was a good story to kind of really reinforce, don't do it, because she really paid for it. Oh, and then she was locked in her apartment, so she had to crawl to the door, and she had a yardstick, and she was able to unlock the door and push it open. And then she went out and laid in the hallway until someone came by to find her to call 911. So it was just one of these awful stories.
Well, and and she's okay. That's often not the
Right.
outcome of the story. So, a
Exactly.
fall, once you fall, I think that question, have you fallen once? If so, you're more likely to fall again. And it's because, the effects of a fall can be dire,
Right.
and they can end in severe injury and sometimes death.
And also mean that you can't be in your apartment anymore.
Right.
So
Right.
that's the tragedy.
Lisa, go ahead.
Hi, Ashley, great topic. I am here in Oak Creek. I'm actually not in Dane County. I work for the Oak Creek Police Department, and I actually participate as the guest expert in Stepping On. And I specifically talk a lot. I've done probably over a dozen of the Stepping On programs. I did some virtually. Now we're kind of moving back into in person. But I talk to people a lot about safety out and about in the community. And, we do talk specifically about Oak Creek. And one of the comments that I get a lot as I go into a lot of our senior living areas is just changes in the community. Where, like we just recently had a bus stop change here in our community where the bus stop is now much further from the crosswalk. And so people are cutting across the street as opposed to going down to the crosswalk. And, I've tried to encourage them to not do that because, when you're in that situation, then you're, rushing because you have to be mindful of cars. But do you guys have any, specific things when you talk about being out and about in the community? Is there any specific things that you always tell people?
Well, the mindfulness, and then curbs, are a big one. We talk about that a lot, just being aware of curbs. And then something we say for winter time, like if you're driving, to keep some kitty litter or some salt in your car, so that, because you don't know if all parking lots are going to be cleared, so that you can create a path for yourself if you need to. But I think the Stepping On guidance for the community safety guest expert is really great information about, how to navigate safely in your external environment. And I can send information about that out if anyone's interested. But thank you, Lisa, for playing that role, because it's such an important part of the curriculum. And, people have talked before, like, oh gosh, we could maybe skip the community safety piece, and everyone is always, no, we cannot skip that piece, because people love it and it is so valuable. So thank you for what you're doing for the program.
Absolutely. And one of the things that you were mentioning earlier about sharing, people learning from one another. One of the things that was recently shared in one of the classes that I was doing was using the grocery store services like, parcel pickup or doing online shopping. And I sometimes I feel like people are resistant to using some of these services because they think, well, I want to be able to pick up my own groceries. I want to be able to do all of these things, but really they were encouraging one another to actually use these services because they do keep you so much safer. You can then drive to the grocery store and pick up your groceries, and you're not putting yourself at risk, getting out of the car in potentially really bad Wisconsin weather, which, can be dangerous for all of us, regardless of whether you're a fall risk. So,
isn't there kind of a trade-off though? I mean, the more independent you stay and the more active you are, the less danger I'm not gonna put it well, but I mean, it seems like if you sort of give up, and I know there's a fine balance. I mean, sometimes you have to do that, but it seems to me that I'm better off if I'm getting out of my car and walking into the grocery store and walking around the store and shopping, because I'm still moving, I'm still exercising, and I'm keeping myself in better balance and that sort of thing. So that maybe there's a sweet spot where you have to realize that maybe you can't do that any longer. But it seems to me that as long as you do, I don't know, it may be worth the risk. I mean, I
Yeah,
don't know.
I agree
I'm not
with you,
expressing
Jim.
it well.
Yeah, no, I agree with you. And what I normally tell people when I'm doing the Stepping On program is that obviously, movement is good. They teach you that in Stepping On, that the movement is good. But what I tell people is when if they need to run errands and it's a day when it's particularly sloppy or dangerous, that they should skip it that day. But sometimes they need groceries. And so then that's when we have made the discussion and made the distinction that, hey, maybe that's a day that you actually choose
Sure.
to do the parcel pickup, as opposed to, walking around trying to get in the store, trying to get back out of the store. So it's absolutely, maintaining their independence, but yet, being mindful of the fact that they might not want to take a risk on that particular day.
Yeah, got it.
I think the other thing is just being aware of services like that drugstores will deliver if they're at home and maybe they're not safe to drive that day because they're feeling they have a cold or they're feeling ill or low energy. Maybe that's not a good day to go get your own medication, but have it delivered. So I think it's the knowledge of the services, not that you have to use them all the time, but it's an alternative. I don't feel, one of the things one class I was taking about driving said, really evaluate yourself. Are you able to drive today? Do you feel well enough and are you in good shape to drive? And maybe you're not that day because you're sick or you've had a bad cold or you've been whatever. And that day you should call and have groceries delivered or have a medication delivered or have a friend bring something, just making sure that you stay safe. I think that's the idea. I think you're right. I mean, we want to be as active as possible. That's definitely a goal, but I think it has to be done with mindfulness of there are times when you shouldn't be driving. Like Thursday, I'm not planning to do a lot of driving.
That's great, Lisa. It's great to hear, what people in other parts of the area, other parts of the state are doing. Anyone else? Jen from Calumet County, what's going on there? I'm calling her out here. We're lucky to get a lot of people from here, and I don't mean to jump in on anyone, but if there are other things going on, it's always great to hear what your community's doing.
I was just made one comment to Lisa, and that is, I think it's really helpful for the Stepping On when the community person is from the community. So when we were in Verona, we had a Verona policeman, and he could talk specifically to issues in their community. This is this particular intersection or this particular parking lot, or, that he could just really hone in on the problems in Verona. And people really appreciated that. And that's why I think it's so nice that you can do that for your community, because there are certain trouble spots the police know about.
Yes, that is true.
And so you can kind of warn people, this is not a good intersection. Please do not cross. Please go to the crosswalk. It takes longer, but it's not safe to cross in the middle of the street. That's a really big risk factor, I think, especially for elderly, because we're slower.
Yeah.
Ashley, I just had one little thought and suggestion. So I went to your website and I kind of looked around at all the different resources. I think what oftentimes happens is caregivers struggle with having those conversations. So, you have the checklist, but I think along what comes with that, because I'm a caseworker. I don't have any problems having frank conversations with people, but my in-laws are going through exactly what we're talking about right now. And, they're stubborn German 85-year-olds, and they're going to do what they're going to do, no matter what my husband and I say. And it's really hard to have delicate conversations or, get physicians involved. So having like a script or just suggested ways you can kind of gently broach subjects with people and loved ones on the importance of A, the mindfulness, or B, talking with your doctor, or, I mean, I hate to say things like this, but, if you fall and you land in the hospital, you might not be coming home ever. It is the reality of your situation. If you're stubborn and not willing to make a change and use your walker, for example, or do less of your outdoor activities, which last year led you to fall 3 times, So it's like, I think people really struggle with having conversations with their loved ones.
That's a great point. Great observation. And I'm going to see, in Dane County, we've got a really strong caregiver support network. And I'm going to see if they have some resources that we might be able to use and post those on our website. Because I think you're exactly right. That's really helpful. That's exactly the type of feedback that's super great. So thank you, Vicki.
You're welcome.
Anything else? We've hit 11. If you have something else, we certainly have time for it. But if you don't, I'll call it a day. Anyone else?
I just want to say thank you again. And thank you, Anne and Lisa and Vicki and Jane, the people who jumped in just to make this such a great conversation. And also thank you, Mike, because I attended the conversation where Bernadette from Madison Fire, she presented. And so she is also helping us with stepping on now as the community safety expert. So just thank you for this space to be able to have these conversations. It's really helpful.
This is fantastic to get together. And can anyone who, from other parts of the state, if they need some help on how to get a program successfully started like you have, can they get in touch with you?
Absolutely. Yes, absolutely.
Okay, fantastic. Well, thank you everybody for joining us today. And
Thank
if you have
you.
any clues for new programs, please send them to me. Thank you.